Medicare 101. Today is the basics of Medicare. How does Medicare work? How do you qualify? How do you avoid penalties? Do I get an advantage plan, a supplement plan? What should I do? Well, let's give you some information so you can make an educated choice. First off, to even qualify for Medicare, are you eligible? Have you worked 10 years or 40 quarters, or your spouse, have they worked 10 years or 40 quarters? That's the first number one priority we need to make sure for you to be eligible for Medicare. Once you're eligible, the qualifying event to start using that Medicare insurance is turning 65. That's the most common. Also, you qualify for Medicare if you've been on Social Security disability for 24 months. If you're coming off a group employer plan, you're eligible, and that's after the age of 65. Or if you've been diagnosed with end stage renal disease. To enroll, you can contact Medicare at 1 800 Medicare, or you can contact Social Security with their hotline number shown on the screen, or by going to ssa.gov. You'll create an account if you don't already have one. They'll verify your identity, and then you can enroll directly through the ssa.gov website. Now, if you're on Social Security when you take your Medicare, generally at age 65, they're going to automatically enroll you. They're going to send you a packet about 3 months before your 65th birthday, and they'll assume you're starting at age 65. If you're not taking Social Security at that time, then you will have to enroll yourself. We help our clients with that all the time. It's not a big deal. It takes about 15 minutes or so, depending on if you have an account with Social Security already, but we can walk you through that entire process. Now, to avoid those lifetime penalties, we need to make sure that at age 65, you enroll in Medicare during your open enrollment period, your initial enrollment period, which is a 7 month window, 3 months before your 65th birthday, then your birth month, and then 3 months after your birth month. So that 7 month window to enroll without any penalties at all. Again, it can be confusing. I understand that. There's lots of misinformation out there. I understand that. We're here to help you. So, when does my Medicare actually begin? Well, assuming you're starting at age 65, your Medicare will begin on the first day of your birth month. Now, if your birthday is between the 2nd and the 31st of the month, it will start the first of that month. If you were born on the first of the month, then your actual Medicare will begin the first of the previous month of your birth month. Again, a little confusing, very easy for us to discuss and talk about, and make sure you are enrolling at the proper time without any of those lifetime penalties. Now, if you are no longer employed and you decide not to activate your Part B, okay, even though they have group coverage, but you're not actively working, you will get a Part B premium penalty. And that penalty is for life. It's not a one-time penalty. So how you have your insurance, is it a retiree plan? Is it through your employer, or is it an old retirement plan? Your spouse's retirement plan, all those different aspects of it. That's what we talk about. We make sure we have a clear picture of where you stand, and we make sure you avoid those penalties. If you get hit with that penalty, it is a permanent penalty, and it's a 10% penalty for every 12-month period that you were eligible for Part B. It doesn't sound like much, but again, it is for life, and it compounds year after year if you didn't do it right. So knowledge is power. When we analyze a client's plan, maybe they're still working and they want to know what the costs are. Is it cheaper to go on to Medicare or stay with my group plan? And we analyze a number of different things. We take a look at the premium. How much are you paying every month out of your paycheck versus how much it would cost through Medicare? Is there a deductible you have to pay every year before your medical plan actually kicks in? How about the co-insurance percentage? Is it an 80-20 plan, 70-30, or nowadays a lot of plans are 50-50 for employers? Maximum out of pocket. What's the most you have to pay out of pocket before the plan finally kicks in at 100%? We look at copays. Do you pay a copay every time you go to the doctor, the specialist, the lab, the hospital? And lastly, and really important, is your prescriptions. Do you have a lot of prescriptions? Do you have a copay for every single one of them? Are they generics? Are they name brands? We look at all that to decide which plan works best for you. Again, we're laying out your options so you know and you can make an educated decision. There are coverage options for your spouse as well. So think about it. If you were going to leave your group plan and maybe your spouse is covered under that group plan, they're going to lose their coverage as well. And if they're not 65, they need to figure out how they're going to have health insurance. So we do have options available as well through the marketplace like healthcare.gov, those Christian share organizations like Medishare or OneShare. And if it's a short term thing, we can take a look at some short term medical as well. So we don't want to forget about the spouse. That's part of the analysis we do to see whether or not it makes sense to switch when it comes time to your Medicare qualifying. So with Medicare, this red, white, and blue card has two different things. It talks about hospital, which is part A, and then your medical expenses, which are part B. So for part A, the hospital side of things, this is what you've been paying for your entire working career that's coming out of your paycheck. There is generally no premium for part A if you have worked at least those 40 quarters we talked about. Now, if you haven't worked 40 quarters, you can see there's prices listed below. That is not very typical. There's a very small percentage of people that fall into those categories. But again, it's part of our analysis to make sure you're going to pay the proper amount. Part A is generally considered hospital. Think of it as anything done when you're inpatient in a hospital, in a skilled nursing facility, anything where you are confined is basically considered hospital or Part A benefits. Then we have Part B, which is your medical. That's like all your doctor's visits, the labs, the tests, the radiology, the MRIs, and so on and so forth. Generally, again, I'm going to speak in general terms. Most people pay in 2025 $185 a month for their Part B. That comes out of the Social Security check if they're getting Social Security. If you're not getting Social Security yet, you've delayed that, then you'll pay quarterly and they'll send you a bill for that. Part B has a one-time annual deductible, once a year annual deductor of $257 in 2025. Once that 257 has been met when you've received medical services, then the plan becomes 80/20. Medicare pays 80% of your approved bills, and then you're on the hook for the other 20% with no cap, no limit to how much that 20% can add up to. Now, I don't want to get in the weeds with this, but just like I said, the standard amount is $185 for most people. But we're dealing with the government. So there's always caveats and grids and things we have to look at. And so, just as a quick example, if you're single, filing a single tax return, if you've made $106,000 or less in 2023, in our example here. So in 2025, Medicare or Social Security goes back and looks at your income from 2 years prior. So in 2023, they're going to look at seeing if you made $106,000 or less, or if you're married, $212,000 between the two of you, depending on how you file your taxes. If you're under those amounts, then it's $185 a month. If you made more, then you're going to pay more. And you can see from the grid there, it could be substantial, all the way up to $628 per month for your Part B benefit. So again, our analysis is we're going to take a look at everything you have and make sure that we have all the information needed to make sure that our quote to you or what we believe your amounts are going to be for your premiums and all out of pocket. We want to make sure those are all accurate. And this is what we do to make sure there are no surprises when we come down the road. Now, if you're a lower income earner, there are some plans, there are some savings programs that Medicare has based on different individual limits, different resources. There are programs that help pay with those, take care of those premiums, and also with your prescription drugs. If you are not on Social Security, then you will receive a quarterly premium statement in the mail from Medicare billing you for 3 months of premiums. So at $185 a month times three, that's $555 quarterly that they would bill you for. Now, you can set up payment options at Medicare or mymedicare.gov. And that's what I recommend my clients do. They'll then take that out as an auto draft out of your bank account every month. And it's not one big hit every quarter. It's just the same amount every month. Once you do file for Social Security, then it'll automatically switch and just come straight out of your Social Security check. All right, so that's how the basic of Medicare works. It's an 80/20 plan, and you're on hook for the 20%. There's gaps in the coverages, things you have to pay. So now that we understand the basics of it, now we have to decide which path you'd like to travel down. On the screen right now, we have a left side, which we call original Medicare, and then we have the right side, which is the Advantage plans. They work sort of similar, but they're handled completely different. So let's go first things first. Let's start with the left side and talk about original Medicare. Original Medicare is the red, white, and blue card that says Part A, Part B, have those start dates on there as well. Part A, again, is your hospital insurance. Reminder, $0 premium generally for everyone for Part A. Part B, for most people, is $185 per month. We would then add a Medicare supplement, otherwise known as a Medigap. Those are interchangeable terminologies, a supplement or Medigap. And that fills the gap. So that 80/20 plan, your supplement comes in and pays the 20%. So now 80% by Medicare, 20% by the insurance company, you have 100% coverage. And then to add to that, we need to add a Part D or a drug prescription plan. That is required by Medicare again, so there's no penalties. We make sure we get that all taken care of for you and help you out with that. But these are the three things you need. You need original Medicare, you need your supplement, and you need your drug plan. So let's talk about those. The biggest difference between a Medicare Advantage and an original Medicare is when you are on original Medicare, you can choose your hospital and your doctors. With a Medicare supplement, a Medigap plan, you can go to any hospital, any doctor, anywhere in the United States that accepts Medicare without being referred there. I told you there are gaps to Medicare. So if we look down the left side of this screen, these are the different gaps or things that you would be responsible for that Medicare either has limits on or there's just a portion you have to pay. So, for example, the top one is your Medicare Part A. Part A is hospitalization, the coinsurance, and hospital costs if you've been in the hospital more than 150 days. Okay. They give you an additional 365 days of benefits, but you would be on the hook for the coinsurance for those 365 days. Medicare Part B, the coinsurance copayments, the first 3 pints of blood, hospice care, skilled nursing facility care, Part A deductible, Part B deductible, Part B excess charges, and foreign travel. You can see highlighted down below, this is coming straight out of the 2025 Medicare and You booklet on page 76. Now, I've fuzzed out some of those areas. I don't want you to get confused with all the letters going across the top. This is the government. They like their alphabet soup. So by far and away, most people have heard the most popular plan out there is a Plan G. So a Plan G is there's 3 different Plan Gs, but the most common one is, I'll call it the Cadillac G, the full-on Plan G. And you'll notice down that grid at all those different areas I just outlined, it shows 100% coverage. However, the Part B deductible, that $257 one time per year, is not covered by a Medigap or a Medicare supplement plan. That is something you would have to pay out of pocket. Otherwise, the 100% just indicates that your supplement would pay 100% of any balance owed after Medicare makes their determination. 100% for that coinsurance, for the Medicare, for the Part A and Part B coinsurance and copays, the blood, the hospice care, skilled nursing facility, Part A deductible, Part B excess charges, and foreign travel, it is limited to 80%. When you go foreign, just get a short-term medical plan anyway, but I digress. So the only thing out of pocket for Plan G is the monthly premium because you are buying an insurance policy. So you're going to have a premium every month. And then the first $257 in Part B care, you'll have to pay out of pocket. After that, the Plan G basically pays for everything else in medical care, excluding prescription drugs. Now, how much are these Plan Gs, Doug? Well, that's a great question. Every state is regulated by the individual state's Department of Insurance. Rates vary by state. Rates actually can vary by county and by zip code as well. Now, the national average, and I'm not including New York or Florida because they are different states, very high prices, California as well, but not as crazy as Florida or New York. But typically, these prices, like I said, they're going to vary based on zip code, based on the state you're in, your sex, male or female, how old you are. Are you doing it at 65 or are you waiting until 73 when you retire? Are you single or living alone? Are you married with your spouse? Are you a tobacco user or non-tobacco user? These are all different factors that play into this. So I cannot give a hard and fast price for you specifically. Give me a call. We'll sit down. We'll talk about what it is specifically for you and your zip code. That's not a problem. But typically, just to put a number on the screen so you have an idea of what we're talking about, A plan G could be anywhere between $115 to $200 per month for that policy. Okay. Again, it varies state by state, depends on age, all those things. You could be closer to the 115, could be closer to the 200. Plan G pays for your medical care, but what about your drugs? Well, that's part D of Medicare, D for drugs. When we sit down and talk to help put that whole analysis together, we're going to ask you for your list of prescriptions. What are your preferred pharmacies that you like going to? And our job is to make sure that we find the lowest possible price for your prescriptions each and every year. There's an initial enrollment period, just like there's an enrollment period for Part B for Medicare. And again, that's at 3 months before our Part B effective date. We want to get enrolled into your drug plan. We do that generally right when we enroll you into a supplement. Your annual election period, every year in the fall, we have that window of time where we make all the changes that will take effect on January 1. So we'll review everything in the fall, again, seeing what changes have been made and so forth. It's really, really important that we review that drug plan every year. That's something we do all the time. Every year, we review with our clients where they're at with their medications. Have they had new medications? Have the pharmacy changed? Have they gotten rid of medications because the pricings can change? Prescription drug, that annual review, like I said, the annual election period is from October 15th to December 7th. Every year, tiers of drugs can change even within the same company. Tiers of drugs can be different between different carriers as well. So one drug could be one tier at company A and company B has it at a different tier. Most companies, tier 1 and tier 2 drugs, which are generally generics, generally they have low copays. Sometimes they're zero. Some individual drug carriers have deductibles, some don't. And those deductibles typically only apply towards tier 3, 4, 5, and even 6 drugs. And then the biggest factor, well, one of the biggest factors is we look at is what pharmacy you want to use and what to do. Who do they participate with? Are they a preferred pharmacy, a standard, or out of network pharmacy? And that really matters. And I'm going to show you why. In this grid, we have 4 very common medications: amlodipine, hydrochlorothiazide, lisinopril, and metformin. Now, the bottom row with the big red zeros, that's the column we're going to look at. If you receive your medications from a preferred pharmacy, so you'll notice in the top left, it says preferred pharmacy. If you receive your monthly medications at a preferred pharmacy, these 4 medications would be $0. Okay, pretty good deal. Go in the pharmacy, there's no exchange of money. You pick up the medications and you're on your way. But if you do not go to a preferred pharmacy, you just go to a regular in-network but not preferred, a standard pharmacy, those same medications would run you a little over $66 per month. The exact same medications. So what pharmacy you go to matters. And by all means, please, please, please don't go to an out-of-network pharmacy, because those same medications, out-of-network, $380. So the pharmacy you go to matters. And again, part of our whole entire breakdown we do for you is we look at what pharmacies are in network, not in network. You'll have drug coverage. It's just a matter of how much you want to pay out of pocket. Now, just like your Part B premiums, your Part D, your drug plan, there are caps and limits. And if you make more than a certain amount, you're going to have an increased amount of what your premium is going to be for your drug plan. So again, using that same top line, if you're an individual making less than $106,000 or a married couple filing joint making less than $212,000, then you're going to pay just whatever the plan says the premium is for that drug plan. Some plans are zero. Some plans go over $100 per month in premium for the drug plan itself, not even including the medications. So if you're on a free plan, or a plan that's zero cost, I should say, then you'll just pay that zero cost. It'll pay nothing. But if you're on the next line down, you made a little bit more, then you're going to be paying not $0, but now $13.70. So whatever the premium is plus $13.70, and so on down the grid there. So the more you make, the more you're going to pay. That's just the way it is. Again, part of our comparison, we take all this into account and take a look at it for you. There are penalties per Part D. If you are a blessed person that says, I don't have any medications, I'm not taking any prescriptions, Doug, I don't need a drug plan. Yes, you do. because if you don't take a drug plan when you're supposed to, you will have, again, lifetime penalties depending on how long you went without a drug plan. Deadlines are important, and our job is to help you make sure you understand that and do everything we can to make sure you're not paying those penalties. So that's original Medicare with a supplement or a Medigap plan. So now we go to the right side of that grid, and now we'll talk about Medicare Advantage plans. What Medicare Advantage is, it's considered Part C of Medicare. It takes A and B and rolls them up together into Part C. Most Medicare Advantage plans also include your drug plan, so it's included in there. So now you just have one card you have to worry about. You don't have the three cards like original Medicare. You have one card that services all of your needs. Now, what Medicare Part C is, the Medicare Advantage, is that's actually run by private insurance companies under contract and approved by Medicare. So you are no longer receiving your health care through original Medicare. You're getting it through an individual insurance company. Medicare pays that company to take care of you, but it's up to that individual company to determine whether or not you're going to receive care. So they provide your Part A and Part B coverages, and they can charge different amounts for certain services. So costs for items and services, they're going to vary per plan. What's your copay? What's your current co-insurance amount? What's the maximum out of pocket that you can pay before the plan actually kicks in 100%? Now, most Medicare Advantage plans offer additional benefits like dental, vision, hearing, over-the-counter services like vitamins or bandages or lotions or creams of that sort. That's considered over-the-counter. A lot of them have also like a silver sneakers or some sort of a gym membership, and then they give you the prescription drug coverage included in the plan as well. Now, you still have to pay that $185 a month. You still have to pay your Part B premiums if you go with a Medicare Advantage plan. And Medicare Advantage it's a 1-year contract. Every January through December is when the Medicare Advantage plan is in effect. So every year in the fall, again, during that open enrollment period or the annual enrollment period, we make changes that'll take effect January 1. And again, that goes from October 15th through December 7th. So here's a hypothetical. I can't show you plan names or anything like that, but this is sort of how it goes. And Medicare, the Medicare, original Medicare with a supplement was you pay a monthly fee to an insurance company and you basically don't have to pay anything else. Okay, that's a real rough guideline of it. So even if you don't go to the doctor, you're still paying for that secondary insurance, that Medigap coverage. Well, Medicare Advantage plan is more of a pay as you go. If you don't have to see the doctor 1 month, then you're not going to pay anything or pay whatever the premium is for that plan. Most of them are $0. So here's an example. Plan 1 on the left, Plan 2 on the right. Plan 1, the premium is $0 a month. There is no cost for this Medicare Advantage plan. There's no cost to go see your primary care physician, $0. And maybe there's a specialist copay of $20. If you're admitted into the hospital, your copay amount you'll have to pay out of pocket is $320 per day for days 1 through 5. Starting day 6, the plan would pick up 100%. If you need an MRI done, they're going to charge you a copay of $320. If you have an ER visit that doesn't result into an admission to the hospital, it's $95. And then they're going to give you a quarterly benefit of $100 per quarter to spend on that over-the-counter catalog. They include some dental coverage, a maximum of $2,000 per year of services that can have rendered. They give you a $200 a year vision benefit. There's no deductible for the plan, and the maximum out of pocket, that MOOP on the bottom, just indicates how much maximum you'd have to pay out of pocket before the plan picks up 100% of everything else. And again, these are in a calendar year. January 1 of the next year, everything resets and starts all over again. Plan 2 on the right, you can see that one has a $35 a month premium. No PCP copay needed. Specialist is only $10. But if you're admitted to the hospital, it's $340 per day, but only for days 1 through 4. And again, starting on day 5 on the plan on the right, plan number 2, it would cover 100% starting with day 5. The MRI in this plan is only $120. ER visits only $90. They give you additional over-the-counter spending privileges of $125 per quarter. But they only have $1,500 a year in dental benefits. The vision is $300 a year, no deductible, but look at that maximum out of pocket. You could be having to pay $7,550 out of pocket before the plan picks up 100% after that. So it's a pay as you go type of model. And you generally have to have your services done through, or your care done through a primary care physician, and then they would refer you out to specialists. So let's talk a little bit about eligibility and costs of your Advantage plan. You have to have Medicare A and B, and you have to live in the plan service area to be able to join. Okay, there's no health questions. Anyone can get a Medicare Advantage plan. There's no health questions. In addition, again, highlighted in red there, in addition to your Part B premium, you have to pay the $185 a month in our example. You generally pay one monthly premium for services in a Medicare Advantage plan. Typically, those Medicare Advantage plans are $0 per month. Each Medicare Advantage plan has different premiums and costs for services, so it's really, really important you compare those costs. That's what we do to show you what your options are where you live and the zip code you live in. There are Medicare Advantage plans for people who are what we call dual eligible, meaning it's designed specifically for people who have Medicare and they're on a Medicaid program through their state. These are typically $0 copays for all the approved services, and they generally have increased additional benefits for dental, vision, hearing, and over-the-counter and so forth. Okay, but again, dual eligible means you're on Medicaid, so there's income qualifications, so forth with that. Again, we talk about that as well. If you're a veteran, thank you for your service. VA has a little bit, some different options because it is like a government plan. So they give you some different options. And option one, you could just get Medicare Part A. You don't have to do Part B, but you'd have to use the VA for all of your medical care and prescriptions. Option two, you could get Medicare Part A and Part B and also get a Medicare Advantage plan or get a supplement plan and still use the VA. It's totally fine. And if you're using TRICARE for Life as a spouse or a retired veteran or a retiree that is a veteran, Part A and Part B is required as well. Again, things we talk about when we discuss your situation. So that's the basic, the 101 of Medicare. And there's three different cards you're going to have. If you're an original Medicare, three different cards. You're going to have your original Medicare card that has your Part A and Part B dates on it. Then you'd have your Medicare supplement or your Medigap card, and then you'd have your drug card. So three cards. If you're on a Medicare Advantage plan, you just have one card. It covers all of your Part A and Part B. It's combined into Part C, and generally it'll have your drug plan built into that as well. So there's pros and cons to everything, and this is no different. Everyone's situation is different. What they expect and want and need for their medical care is different from person to person as well. Do not take advice on what plan you should get from your neighbor, from a family member, or even HR. Talk to someone who can ask you all the relative questions. But here's a little bit of a summary. So on the left side, Medicare supplement or a Medigap plan with a prescription drug plan. Well, you're going to pay higher premiums generally because you have to pay for those plans, but you don't have to pay copays or coinsurance. Freedom to choose your doctors and hospital. No referrals or authorizations needed. Some services, however, aren't included. The original Medicare and supplements don't have routine dental, vision, hearing, over-the-counter memberships, over-the-counter benefits or gym memberships. Gym memberships are being offered more and more with supplements, but again, that's why there's the asterisk there. That varies. And you can be covered anywhere in the U.S. and limited service outside the United States. How about the Medicare Advantage plan that includes the prescription drug plan? Well, you're going to have lower premiums, generally $0 for those premiums for that plan. You have a maximum out of pocket of all those different copays that you'd have to work up to finally have the plan kick in 100%. These are network plans. Some of these networks are nationwide, but it's an HMO or a PPO plan, so you have to stay within a certain network. Referrals for specialists are rarely required, but you will need authorizations, and again, that'd be coordinated generally through your primary care physician. And a lot of the Advantage plans include the extra benefits like routine dental and routine vision, hearing, does have over-the-counter, and gym memberships are generally included with that. Again, limited services outside of the U.S. and within the United States, you have to stay within the network for most of your services. Do you need a do-over? Maybe you picked the wrong plan when you first got into Medicare, or you want to know, how can I switch if I make the wrong, can I try things out? And the answer is yes, you can. So if you want to transition to a Medicare Advantage, or from Advantage plan to a Medicare supplement plan, okay, let's say you tried out the Medicare Advantage, you're saying, this isn't for me, I want to switch to the other one. You can do so. If you start your Medicare journey with an Advantage plan, you have 12 months to be able to switch to a supplement, and it's a guaranteed issue basis. 12 months is from when your Part A effective date begins. If you stay on a Medicare Advantage plan longer than 12 months and you want to switch to a supplement, you can do so, but there's a couple time frames you have to meet, and you'd have to generally health qualify through that insurance company to qualify for a Medicare supplement. So it could be a little more difficult if you're health challenged. Now, the annual election period is in the fall. We've talked about that a few times, October 15th through December 7th. But there's also an option to be able to jump into a plan during open enrollment in January 1st through March 31st. How about the other way around? What if you started with a supplement? You say, I don't like all these premiums anymore. It's not worth it. I want to switch to an Advantage plan. Can you do that? And the answer is yes, you can. But again, there's qualifying dates and provisions we have to satisfy to make that happen. So if you go with a supplement, you can switch to an Advantage plan any year you want during the open enrollment period, that October through December dates. The Advantage plan would start on January 1st. There's no health questions to switch onto an Advantage plan. So if you're health challenged, it's not a problem switching to an Advantage plan. But again, that has to be done only during the open enrollment periods. We will walk you through that if you want to switch. Hope that helps you out. Hope that gives you some basic information. I would love to work with you. We're independent agents, brokers. We can shop around everywhere. We're not beholden to just one company. We're not captive agents. We can shop around and find plans that are best based on your needs. We offer all the available plans, and a majority of the carriers in the industry, we have those. We shop for your Medicare and your prescription drug plans every year to ensure you're paying the lowest price available. We're accessible. You're going to have my direct number. You're going to be able to call us. We're not a call center. You're not going to be talking to someone in a cubicle. It's a real person providing you real service. We work for you, not an insurance company, and therefore we don't have any bias, and we're not biased on any particular carrier or company. We find what's best for you. Here's contact information for you. Would love to help you out. What's next? Give us a call. Set up an appointment. We'll sit down. We'll talk with you. We'll go over your situation and see what works for you. If you have any questions, I'm going to leave this up on the screen. You can screenshot it, grab your phone, screenshot it, watch us over again, whatever you need to do. We're here to help you when you're ready to be helped. I hope you've found this educational. Hope this helps you. And I thank you for your time, and God bless you. If you'd like a copy of my free Medicare planning guide, click the QR code right here or the link below for your personalized copy sent directly to you.